My name is Kaylee Noblin. I am a first-year student at Oklahoma State University's College of Osteopathic Medicine at the Cherokee Nation, and I'm excited today to be presenting for OSU's Research Week on behalf of my research team, which also includes student Dr. Hayden Jacobs and Dr. Micah Hartwell. We looked at the trends in the prevalence of Down syndrome through the COVID-19 era, an examination of the National Survey of Children's Health 2016 to 2022. This project started with an interest in genetic conditions and on how health and medicine and research can affect the lives of those living with genetic conditions, which led to us identifying a gap in the literature that we are trying to help fill with this project. So, to get started, Down syndrome is the clinical manifestation of trisomy 21. It is the most prevalent chromosomal abnormality in live births. The lifetime prevalence of Down syndrome is known to be increased compared to 1950. However, throughout this time, there have been limited birth registries and data availability on the survival of individuals with Down syndrome, which have made precise calculations of these rates through the years very difficult. However, we do know that the prevalence of Down syndrome increases with increasing maternal age and with medical advancements leading to longer survival of individuals with Down syndrome. On the flip side, the prevalence decreases with early termination of pregnancy following prenatal diagnosis and decreasing overall birth rates. These factors have been offsetting each other and have been shown to pretty much lead to a stabilization in the prevalence of Down syndrome since the 1990s. However, as far as we know, and to our knowledge, the DS prevalence has not been explored throughout the COVID-19 pandemic era. So, this study aims to assess the changes in the prevalence of Down syndrome among children under 18 years of age from 2016 to 2022, and also to identify disparities by ethno-racial groups among these individuals. So, to do this cross-sectional analysis, we used the National Survey of Children's Health solely from the years 2016 until 2022. We used design-based chi-square tests as well as regression analyses on the sample as a whole. And then whenever we broke it down by ethno-racial groupings, we used chi-square analyses to test for differences. So if I can direct your attention to the chart at the bottom, we found that the weighted percent of Down syndrome prevalence increased overall from 0.14% in 2016 to 0.26% in 2022, which you can see by the blue line in the figure. If you look at the orange line, this is also showing the weighted percentage of Down syndrome prevalence, but it is broken up by year. Important to note here, from 2017 to 2019, where you can see that dip, there was a reduction in the sample size for the National Survey of Children's Health to around 20,000 to 30,000 individuals, where normally they aim for 50,000. And after 2019, those numbers increased in total sample size back up to around the 50,000 mark, which introduces a limitation in our study, but we thought was worth mentioning. So going back to that blue line, our regression analysis showed a statistically significant increase of 0.022% annually, which means that from 2016 to 2022, on average, the prevalence of Down syndrome increased by 0.022% each year. And then if I can draw your attention to the table at the top, whenever we broke this down by ethno-racial groups, we found that the prevalence of Down syndrome was highest among American Indian, Alaska Native, followed by Native Hawaiian, other Pacific Islander, followed by Hispanic children. However, we do want to emphasize that the distribution of Down syndrome that we found among these groups was not statistically significant for the combined years. However, we still did think that it was important to include and to report as we found it. So in conclusion, to our knowledge, this is the first study to assess the prevalence of Down syndrome among children through the COVID-19 pandemic, in which we found a significant increase in its prevalence from 2016 until 2022. However, we do want to emphasize that we are not suggesting nor are we aware of any correlation between the prevalence of Down syndrome and the COVID-19 pandemic or virus. There are a variety of social, demographic, genetic, or other factors that could be at play to explain this observed increase, including average maternal age or differences in rates of conception and childbirth that we would point future research to. So as a whole, the study contributes to the evolving landscape of Down syndrome prevalence, highlighting the importance of considering external factors in shaping health outcomes. The observed variations in Down syndrome prevalence among diverse populations that we looked at using ethno-racial groupings underscore the complexity of such genetic disorders such as Down syndrome, emphasizing the necessity for multifaceted, inclusive research to guide public health interventions. So with that, and with the references at the bottom, I want to say thank you to my team, and thank you for listening to my presentation today.